Morning everyone, Dr. Brian Steiner here at Wilkins Spinal Care, back with another Facebook video for the week. Just to recap the last couple weeks, we introduced different topics such as chiropractic care, the nervous system. Last week we talked about patient communication. Now we're going to start jumping into a topic that you all are really excited about, a lot of you have been talking about the last couple weeks. Now we're going to start talking about different conditions that chiropractors treat. If you have any questions regarding any material from past time, feel free to send me a message. I'll be happy to answer any of those questions for you. So today we're going to talk about a very common condition of the spine that a lot of patients know about and a lot of patients have, and that's degenerative disc disease. And we're going to talk about what it is, how to manage it, how to prevent it, and what chiropractors can do to help. So when people hear the word disease, they start to freak out. They're like, oh, I have a disease. Am I going to die? No. Degenerative disc disease is something that you don't want, but it's definitely something that can be managed with care and treatment. So in order to give you a better representation of what degenerative disc disease is, I have the spine here to give you a better visual because I think it's going to really help you guys understand a lot more. So in between each bone, you have the disc spaces that we've talked about in past time. What happens essentially is the disc thins and degenerates. And what happens is the bones begin to weaken, and then you start to see something called spurring. So in the last couple days, I posted a couple pictures of some X-rays that were degenerative disc disease, one in the low back and two in the neck. You see how close those bones are to each other. You see the degeneration of the bone with the spurring, and then you saw the one with the fused neck. That's a patient who has degenerative disc disease that never got it treated. Unfortunately, with patients with degenerative disc disease, once the damage is there, it's done. It can't go away, but it can be slowed down or stopped with care. So what symptoms are we seeing with degenerative disc disease patients? Something typical that a chiropractor would see. Pain, stiffness, radicular symptoms. Patients with degenerative disc disease in the neck will see symptoms going down the arms and the hands. Patients with low back DDD will see symptoms going down into the leg, the knee, the feet, and the toes. The low back is the most common area because it is the most weight-bearing portion of the body. Now, how do we diagnose it? Usually any doctor, whether it's a chiropractor, medical doctor, whatever, they're doing an orthopedic examination to help elicit that pain to see what nerve root it is or what it could possibly be. And more importantly, X-rays. Again, those X-rays that I showed you are patients with degenerative disc disease, and you can see that through X-rays. So now, how do you get it and how do you prevent it? So a lot of patients are like, it's because you're old. A high percentage of people who are older have degenerative disc disease because they've been around much longer. But I have taken X-rays of patients who are 80 years old who have the spine of a 20 or 30-year-old, and I've taken X-rays on 20, 30-year-olds who have the spine of an 80-year-old. So the main reason isn't age. The biggest reason is trauma. And when I mean trauma, yeah, I could mean a fall or some traumatic event because that does place stress on the body, but I'm talking more like repetitive motions, micro traumas such as poor posture, people who work at a desk all day, somebody who lives a sedentary lifestyle, someone who's heavy. The reason why I say these things are people who are typing on a computer. They're in that flex position or texting on their phone, things like that. They're putting pressure on their neck. So you'll see a lot of patients who do that have degenerative disc disease in the neck, and then you'll see people who live a sedentary lifestyle or obesity who have DDD in the low back because that's such a weight-bearing part of your body and you're putting so much stress in that area. So how do you prevent it? Exactly the opposite of what you're doing to cause it. Get up off your desk for a little bit. Walk around. Stay active. People who are heavier, exercise, eat better. The biggest thing I've been seeing with patients are the ones who are the most active and the ones who do things around the community are the people who don't have it. It's just that simple. But patients who do have it, what do you do to manage it? So there's some options. You have surgery. you have steroid injections, you have physical therapy, but most importantly, you have chiropractic care. So surgery is something that you do it, but then patients tend not to see any difference. So basically, you just spent money on a surgery for nothing. People with steroid injections, it's essentially only numbing the pain. It's not actually eliminating the cause of the pain. Physical therapy is a good option. You're headed in the right direction. But chiropractic care offers a lot more because different chiropractors offer different things. Here at our office, we provide a light adjustment. You don't want to go pounding into that area because it's already weak. You don't want to make it weak. You want to make it strong. But the biggest thing about our office is that we offer spinal decompression therapy. Spinal decompression therapy is for patients who have disc herniations, failed back surgeries even, degeneration in the spine. What happens is especially people who have pain down the legs and arms, we open up that space. We want to make sure that we pump that disc and it essentially rehydrates it and it gets you out of your pain. That's the biggest thing about our office. That's why we're not Wilkins Chiropractic Clinic. We're Wilkins Spinal Care because we're essentially trying to make that spine healthy again. We're trying to rehydrate that disc with this decompression therapy. So the biggest thing about chiropractic care, whether you get the spinal decompression or whether you don't, chiropractic is headed in the right direction because it's an alternative way of treating you without using drugs, without using surgery. And that's what we want to do. So that's all I have for you today. Now next week, I'm still trying to decide what I want to talk about. I think I'm going to talk a little bit about disc herniations because, again, we want to strive for that decompression because a lot of patients go that surgery route, and we don't want them to go that surgery route. We want them to try the decompression first. So I think next week I'm going to talk about some disc herniations in the neck and the low back, and we'll go from there. But if you have any questions regarding today's material, feel free to send me a message. I do have a source for you guys. It's more of a case study. A lot of these spinal degenerative disc disease cases are case studies. And if you want to look up more, you can always type in degenerative disc disease on Google, and a lot of stuff will come up. But again, have a great day. I will talk to you guys next week, and enjoy the rest of your week. Bye.